We know how much you want to keep you and your family safe, and that includes the real concerns about the coronavirus. We asked you to text us your questions that you have. We've received many of them, so thank you for sending them. Here to answer them is Dr. Michelle Barron. She's the Director of Infection Control and Prevention at UCHealth. Thank you, Dr. Barron, for coming in.
My pleasure.
So a lot of people are asking about travel. That is like one of the most dominant conversations right now, especially on our It Takes a Village page as well. Kelly texted us this morning. She asks, I'm traveling to Rome in 3 weeks with my healthy, immunized 10-year-old. I'm very concerned about the virus with the travel and recent news on increased cases. What are your thoughts?
I think it's a fluid situation. Unfortunately, we don't know what's going to happen in the next couple of weeks in terms of the number of cases in Italy or other places in the world. The CDC, cdc.gov, has a great website that includes travel advisories, and they level it at 3, 2, 1, depending on 1 is just standard things that you would normally do to keep safe. 2 is to think about enhanced precautions, you know, maybe washing hands more frequently, and 3 is obviously what is going on in China right now, where they advise you not to actually go. So I think it's probably okay right now, but I would probably check the CDC website. I would check with your travel agent or your company that you booked your trip with to make sure you have contingency plans in the event that they decide that the situation is changed.
The next big topic we saw were about the face masks. This question comes from Shelley. She asks, would you recommend wearing masks if traveling abroad?
No, you know, I think the benefit of a mask is if you actually have symptoms. So if you're coughing, sneezing, that's a way to contain it. I think otherwise people get a false sense of security that they're wearing it and that it makes them safe, when really, hands, hands, hands. Anything that you touch. I saw somebody wearing a mask yesterday and they had it right over their mouth but beneath their nose. Probably because it's hard to breathe after a certain point, and that really kind of defeats the whole purposes. So I think especially on a plane, if you're going to be on a plane for a long period of time, the likelihood that you're going to reach under or move it around and lose its effectiveness is probably higher than if you just pay attention to your environment.
We were talking right before we got on the air about the CDC announcement yesterday that it's going to be probably expanding in the United States and people should start making plans for that. Do you think we are overhyping that whole announcement?
No, I think the key is to understand what the context of that was. It's like when we talk about the weather and we're going to get a lot of snow. So we could get 2 inches, we could get 2 feet, but you don't quite know what's going to actually happen till it happens. And I think that's similar to this. And what preparations would you make if you had 2 feet of snow on the ground? Schools are going to be closed. You're not going to get to the grocery store. So I think take that approach to it in the same context of like, I need to just have a plan. If I can't take my kids to school that week, what would I do? Can I work from home? Do I have enough food and water in the house just in case I can't get to the grocery store? So I don't think there's a need for panic at this point, or probably at any point. Just planning is essential.
And that kind of gets us to a question that Melissa sent in. She says that she's worried about school safety, that her students are freaking out. She doesn't know what to tell them. What should she tell them to help them ease that fear?
Sure. So remind them at this point there's no cases in the United States that are not associated with travel. And so the people that have it have, well, 2 exceptions, people that lived in households that had someone with coronavirus. And they're still more likely to get the flu or other respiratory viruses at this time. Kids especially, I think it's a good opportunity to teach them to wash their hands really well, clean off their desk, wipe off their cell phones, all the things that they probably handle on a regular basis, and just being aware, like how often do I touch my face? How many times have I washed my hands today? That's really a good way to keep themselves safe from anything that's out there right now.
Terrific answers. Thank you for coming in and sharing with us this morning.
It's my pleasure. I hope that helps.
Dr. Barron, absolutely.